examining cells under the microscope, first we have to make a blood smear. For that we require glass slides. We require 2 of them. Okay. So, how to collect blood? You have to collect what is, again this is a mandate, this is an obligation, that if the external examiner wants you to work with capillary blood, you have to use a needle and collect it from your own finger. Okay. Own finger. Where have you understood the term, or have you come across the terms lateral and medial till now in anatomy? No. So, lateral is away from the midline of the body, medial is towards the midline, and one organ or any organ or any exterior or interior, they are described according to relative to one another. So, what is midline from the body? So, the simplest example is, do you know about the anatomical position? 4-5 days you should be acquainted with this. So, you have not attended classes since Friday? Okay, leave it. If you have not known, then you have to know about the anatomical position. So, anatomical position. So, if the hands are kept like this in the anatomical position, right? If the hands are kept, so away from the midline, which finger do you think is away from the midline? Most away from the midline is the thumb, right? Thumb is most away from the midline. So, it is the lateral most finger. So, among the fingers, which is the most medial one? The little finger. You have to, whenever we speak of lateral and medial, these terms, it is in the anatomical position. If you just rotate your hands, it will not be like that. Rotate like this. This rotation is called pronation. Forget about that for now. We'll discuss it later. So, this is the anatomical position. Lateral most finger is the thumb. Medial most finger is the little finger. Now, if you have to describe the middle finger, it is lateral, it is medial to the thumb, but it is lateral to the little finger. Things are described like this. Whenever you study about internal organs, the structures and all, medial, lateral, these terms will be, those 2 terms will be used like this. That this is medial to this, that means this is more towards the midline from that one. Okay, right. So, the medial, which there are 2 bones in the forearm. This part from the shoulder joint to the elbow joint is called the arm. In the upper limb, this part is, you have to call it now as a medical student, you have to use medical terms. A layman will say that whole of the upper limb, he or she, a layman will call the upper limb a hand. But medically, shoulder to elbow joint is arm, elbow joint to wrist joint is forearm, and distal. There are again 2 terms, proximal and distal. Whatever is towards the heart is proximal, whatever is away from the heart is distal. So, what is distal to the arm is the forearm, and distal to the forearm, that this part is called the hand, which consists of a palmar surface and a dorsal surface, palmar surface and a dorsal surface. Okay. So, these are just to acquaint you. So, which is in the forearm there are 2 bones, radius and ulna. So, which is the medial one? Ulna. The radius is lateral, the ulna is medial. So, when we are we will describe like this, where do we prick for getting capillary blood? Towards the ulnar border of the fingers, usually we use the middle finger or the ring finger, okay, to take capillary blood. It can be taken from other sides such as the earlobe. For very small children, it can be taken from the heel. So, where it is easily available, capillaries are more and easily available. Capillary blood. Capillary is one type of blood vessel. Arteries, veins, capillaries. Okay. Now, the examiner, if the examiner wants that you have to use capillary blood, he will not be provided with venous blood. Okay. If the examiner wants. So, you have to learn how to prick your own finger, and before pricking, what is a common procedure, or what is the precaution, that you have to clean the area. To clean the area, you use an alcohol based solution, spirit, and you require cotton just to rub the spirit to the finger, to that area where. So, after applying spirit and cotton, that means after applying the spirit and cotton, we need to dry the area. Now, who have already attended classes, tell me why to dry? So, that is one, but the most important is why we are using this alcohol based solution. So that the area is cleaned. It has an antiseptic action. So, that is so that the area is cleaned. So, it requires some time. So, to give it some time, we dry the thing. So, by the time it dries up, already the antiseptic action is expected to take place. So, the antiseptic action is already there. So, this is the reason why we apply it. So this is the primary reason. Another reason is, if we don't allow sufficient time, don't allow it to dry, this some of this at least alcohol based solution may get mixed with the blood. But what we require is blood. To examine blood cells, we require blood. We don't want any other thing, any other fluid to dilute the blood. So these two things are achieved by drying. The blood is not getting diluted, and first of all, the antiseptic action what is required, by the time it is drying up, the antiseptic action is already there. Now then we prick. Okay, it should be a single deep prick. No, there is no hard and fast rule that how much to prick, how much. This will come by practice. How to collect capillary blood by pricking using a single deep prick by a needle. Okay, so then the thing is that blood has to flow out freely. Free flow of blood. It is not like a gush of blood. Which are the most deep seated vessels? Arteries. This knowledge you should have from school. That means basic biology. Deep seated vessels, arteries, and blood flows. There is that is more. I will not call it turbulent flow. That is a separate thing. Laminar flow. It is a laminar flow. You will come to know about these terms when you study about the cardiovascular system. But blood flows. So when if any artery is injured, then blood gushes out, sprinkles out. Okay, blood sprinkles out. But capillary blood will not sprinkle. It will just like oozing out. But it should be freely flowing out. Okay. So what happens is, if the prick is not deep enough, in the initial days you will be anxious to prick your own finger. If the prick is not deep enough, what happens? What is the common practice? To squeeze out blood. This is what comes immediately to our mind, to squeeze out blood like this. What happens? What is the disadvantage of that? Okay. Blood, what happens is that blood is not coming out. Tissue fluid, due to squeezing, fluid is interspersed between various cells. This is called tissue fluid or interstitial fluid. Okay, you will know about these things. You have just joined. So interstitial fluid. So tissue fluid mixes up with the blood. Again, what happens? The blood is diluted. So if more of tissue fluid is there and less of blood is there, then where do we find the cells? Okay. So to make a good smear, first free flowing blood has to be taken on a slide. Each step is very, very important. Unless this is free flowing blood, my ultimate objective of finding and counting the cells and getting the result of my experiment is not going to be, my objective will not be fulfilled. So so after you get the blood, for beginners I will suggest, keep the slide on a horizontal surface. Keep it on a horizontal surface, or you will be provided with those. So keep for just making the smear, keep it on any horizontal. Keep it on your working table. Okay. For the beginners, don't keep it in your hand, you will face difficulties. You can do it once you become experts, you can do many things, but for beginners I will suggest keep it on a horizontal surface and use the breadth of another slide. This is called the spreader slide. This blood 1, 2, maybe 3 drops maximum drops. If you calculate it as drops, make it take the blood drop here near one end of one slide. And another slide, this now will be the spreader slide. Another slide is taken, and just for showing you, you do it keeping it on a horizontal surface. Don't hold it up. Okay, you keep the slide in front of that blood drop, in front, somewhat in front of the blood drop. Now draw it backwards so that this edge comes over the drop of the blood, and allow the blood drop to spread. And now each part, each step is important. Without spreading, if you try to draw the smear, then it will not be a good smear. Allow the blood drop to spread. Okay. After spreading, and just consider this is over this surface, not in my hands. For in my hands I am keeping it just to show you. Then you draw with a single. If you hold it in your hand, again this step you may make a mistake. So if it is on a horizontal surface, it will be better. You hold like this, and when the blood has already been spread over this edge of the spreader slide, then draw with a single stroke. Single stroke must be used for drawing the smear. Otherwise, there will be gaps in the smears, and staining process, again it will hamper the staining process. So, and each of these steps is important, each line is important. If anything is wrong, you will face difficulty, especially as beginners. Okay. So, after staining, after drawing the smear, keep it for 1 minute, just dry a little, keep it not 30 seconds, 1 minute. Then we apply stain over the smear. Now, how to apply the stain? For those who are new, we will show you at the table. This is the stain which we are using. This is called the Leishman stain. There are other stains in the form of GMSA stain, right stains. What we are using here in the Leishman stain. This is after the name of the person who has described his composition and all. You will find the names of these individuals, these scientists, these biologists in almost every topic we discussed. This is the Leishman stain, and after applying the stain, after 2 minutes, we have to apply either distilled water or buffered water. This is buffered water, what is available over here. Now, during applying stain, we will show it over there. We have to count the number of drops, because what is the importance of counting the number of drops? Yes. Counting the number of drops to be sprayed over the smear to stain the smear. Whatever the number of drops of the Leishman stain, double the amount. Whatever the amount of the Leishman stain, double the amount of distilled water has to be taken, or the same amount of buffered water. So, if it is say 6 drops of Leishman stain, 6 drops of buffered water. If it is distilled water instead of buffered water, it will be 12 drops. Only if it is 6 for Leishman stain. So, counting the number of Leishman stain during applying, it is important. So that during applying the distilled water or buffered water, we know the number of drops we have to add. Without this, maintaining this proportion, again the staining will be not correct and cells can't be examined. Magnification 10x means 10 times it will be magnified, the object. Magnification 40 or 45 it is written, that is magnifying the object 45 times. If it is written 100, it is magnifying the object 100 times. Okay. This eyepiece lens is magnifying the object 10 times. So, if you use the eyepiece lens and say the 40x, what is written, that is called the high power objective lens. 40x is called high power, 10x is called low power, 40 or 45. So, the total magnification object is magnification of the eyepiece multiplied by the magnification of the objective lens. So, if we are using the 100x lens to focus an object, it is 10 into 100. Because the eyepiece is usually 10, it is written, whatever will be written, that is the magnification. It magnifies the object 10 times, and say it magnifies the object 40 times, then the total magnification is 10 into 40 times. Whatever you are looking at, this is more or less good for beginners, more or less good.